Dear friends, I'm Yann Le Cam, the Chief Executive Officer of EURORDIS, the European Organization for Rare Diseases, and also the Vice Chair of the European Union Committee of Experts on Rare Diseases. Over the past 15 years, EURORDIS has created a united community of over 560 patient organizations from 51 countries. Joining forces this way, we speak with one strong voice in order to promote rare disease as a public health priority and to take action to raise awareness, to promote research, to foster healthcare, as well as adapted services and development and access to innovative medicines. I'm speaking to you on the occasion of the 6th Rare Disease Day. This year, Rare Disease Day 2013 focuses on rare disorders without borders, a slogan that emphasizes the need for solidarity and cooperation around the world, but also between all stakeholders for real and sustainable solutions for people living with rare diseases. Rare Disease Day was created in 2008 by EURORDIS and the Council of National Alliances. National Alliances are the organization that brings together the rare disease patient groups at the national level in one country. There are 30 such national alliances in Europe and around the world. Our common objective with the Rare Disease Day is to raise awareness to the general public and the policymakers to make rare diseases a public health priority and to address the needs of rare disease patients and those who care for them. Over the past 6 years, the event has grown in popularity, and last year we had up to 63 countries and regions participating to the Rare Disease Day. This year's slogan, Rare Diseases Without Borders, acknowledges just how much we need each other in order to find solutions. It reminds us that fighting diseases which affect small and scattered populations with rare expertise, fragmented resources, needs to get together and to have cross-border cooperation. The solidarity of patients' organizations gathered into national alliances as well as at the European-wide level through EURORDIS offers the need to be matched with similar cooperation and unity amongst and between all stakeholders. Policymakers, civil servants, national competent authorities, scientists, health professionals, companies and professionals from the pharma industry, we all need to come together to share knowledge, create best practices, and avoid duplication of efforts so that we can make the most of the limited available resources. Indeed, this is already starting to happen. In recent years, EURORDIS has developed a strong, long-standing partnership with NORD, the National Organization for Rare Diseases in the USA, as well as a new partnership with the Canadian Organization for Rare Diseases, CORD. We are in the process of developing similar partnership with our friends in Russia and in Japan. Together, we are progressively creating Rare Disease International, an international movement to support each other mutually in our efforts, but also to speak with one global voice to promote rare diseases as a public health priority. The European and American agencies that oversee treatment development, orphan designation and authorization for market authorization of medicinal products have streamlined their work in certain processes that helps rare disease treatment to be brought to patients on the European and American markets. Other countries such as Japan are joining this process, which is open to other countries which we hope will join in the future. The International Rare Disease Research Consortium, EURORDIS, initiated in 2011 by the European Union and the United States, is under rapid development with friends from Canada, Australia, Japan and other countries. It brings together knowledge, talent and resources from different countries with the common objective to speed up the development of 200 therapies by the year 2020 and diagnostic tools for most rare diseases. In Europe, key new policies are taking the momentum further. The EU directive on patients' rights to cross-border healthcare, which was adopted in 2011, is one example of how policies can be essential to exchange beyond boundaries. We are now working hard and being vigilant for its translation into practice with the European Reference Network of Rare Diseases, but also an actual cross-border access to knowledge and services so that resources and treatments for rare diseases are more equitably available. Another example is, of course, the European Council recommendation of 2009 for an action in the field of rare diseases, which mandates the 27 EU member states to develop national plans by the end of 2013. In this context, Rare Disease Day 2013 will play a key role in reminding to all stakeholders and policymakers how important it is that national plans be adopted before the end of this year. Concrete national plan, we would care for people with rare diseases in the areas of prevention, of diagnostic, of access to care, of research, of information and social services. This momentum is going beyond the European Union. The United States of America are revitalizing their own national strategies when other countries like Canada, Uruguay, New Zealand, Australia and Japan are developing their national plan or strategies or implementing it. These are exciting times for the rare disease community and we need to share our experience. On the Rare Disease Day website, you can see all the groups that are participating this year around the world and you can add your own information for your country. Don't forget that there is free downloads for the Rare Disease Day logo, the banner, the poster and the fantastic video that has been developed for you this year. Please post on the Rare Disease Day website the photos and videos of your own events that you're organizing locally in order to share with the others. If you're raising hands with friends or professionals and policymakers for Rare Disease Day, please take photos and post them on the website. On behalf of EURORDIS, it is a privilege to support and encourage your efforts all around the world. We wish you a warm and efficient Rare Disease Day 2013.